So good morning, everyone. Welcome to our first Health and Government Operations, our Public Health Subcommittee meeting. Today we have 3 bills on the agenda and Erin is going to go through them. I want to thank you for your time and for being with us this morning, okay? So Erin, will you be so kind and start us with House Bill 28?
Hold up.
You ready?
Yes.
Someone says, okay. This bill requires applicants for the renewal of a license or certificate issued by a health occupations board to attest to completion of an approved implicit bias training program the first time they review their license or certificate after October 1st, 2021. And then beginning in fiscal 2023, the governor is required to include in the annual budget bill an appropriation for the office that is greater of either $1,788,314 or 1.2% of the total funds appropriated to the department in that year. The office is also required to publish on its website health data that includes race and ethnicity information collected by the office.
And I have, Erin, I just realized that it's not 1.2%. Look at the fiscal note. It's actually that sum was wrong. It's actually, and it's in the fiscal note correctly on the last page. 1 second, please. I think is 0.12%. It was an error.
Yeah, additional comment,
Yeah, it's,
sorry.
yeah, it
So
should be, it's okay.
it's supposed to be
0.01
amount that I read, the 1.7 million is correct, and then it would be, I'm sorry, 0.012%.
Yeah,
0.012.
yeah, it will be 0.012%.
So we would have to make that amendment to the bill.
Yes,
Mm.
okay, just to make sure.
Yeah, so in the bill, you all have a reprint version on page 2 in line 32, that 1.2% would need to be amended
Right,
to say 0.012%.
so that's just basically, that was an oversight on our part. But the fiscal note did have it correctly because we, it was an error.
Right.
So thank you so much.
And then there is an amendment,
Yes,
and I sent you, hopefully you all received it, a reprint version of the bill that incorporates the amendment that's being offered by Payne Melnick. And that's on page 6 of the bill.
I'm sorry, when was that sent? I don't see it.
It was either last night or this morning.
yeah, it was sent to your emails. And I know Delegate Barron says he's looking for the Zoom link. Can someone send him the Zoom link again?
He's getting resent the Zoom link.
Wonderful, thank you. Anything else, Erin?
The amendment is on your reprint, page 6. After line 16, this has to do with the requirements of the bill that applicants for health occupations licenses or certificates have to attest to completing the course, an implicit bias course. And it just alters the requirement to provide that they only have to do it one time and on their first renewal cycle that occurs after April 1st, 2022.
And I work with the boards just to make sure that they had time to implement it and that it would work with their system. And this is the language that they required. Anything else, Erin?
That was all. That was all the amendments that were offered.
Are there any questions from the members? Seeing Delegate Rosenberg.
Move favorable. Are you seeking a motion?
Yes.
It's in
Second.
the amendment.
Okay, so it's been moved and second. The amendments have been moved and second. Any discussion on the amendments? Seeing none. As on the bill as amended, House Bill 28, is there a motion?
Move the bill.
Second.
Amendments are we? I
We're
had a
mov-
question.
Go ahead.
I asked, what amendment were you moving and seconding? There are
We-
2 amendments. Are you moving them both?
We're moving them both.
Okay, and then the amendment that you're clarifying the amount
In the public.
to 0.01% of the budget, what does that end up being? What's that dollar amount today?
Aaron,
That's the 1,788,000 that was calculated based on a 0.012%.
And what is that $1 million a year? It's per year, is that right?
yes, and that's what they got this last year.
I'm sorry? That's
It's the same amount that they received last year.
okay. And what is the $1 million paying for again? Can you remind us all?
It's the Office of Minority Health and Health Disparities for their budget.
And is this their only funding, or is there additional funding sources?
Is there only funding, but in the bill, it actually says that they should seek federal funding or grant money as well.
And this percentage that they're getting, that includes the federal funds that they get, or is that,
It does not include federal fund.
okay, because we can't do that with federal money, correct?
That's
I
correct.
guess we could, but okay.
Yeah, you can.
All right, so with the amendments, this would put roughly $1 million a year into that department.
That is correct.
Is it to develop that curriculum or just a general funding mechanism?
It is their budget. Every year they get more or less that amount, but this will put it in statute that they should get it. At least that's the floor. And they develop programs in that office that deals with the health disparity, the chronic illnesses, education in the communities of color. They have a lot of disparities. So that is the requirement.
Okay, thank you.
My pleasure. Good morning, Delegate Barron. See you. Any other questions on both amendments? One that deals with the budget and one that makes it easier for the implementation date. We moved it so that the boards can, not struggle and they're able to do it when it's comfortable for them. Any other questions on those amendments?
I have one more question.
Yes,
Is there a provision? So this is for medical licenses, is that correct?
it's for professional healthcare professionals.
Okay, so if someone has received this training in college, I'm assuming that the universities are making this part of coursework, is that correct?
Not necessarily. It's not consistent across the board.
But if they have that, are people able to get credit for coursework that they've taken that would fulfill that requirement?
No, and the discussion was then everyone felt that it doesn't hurt to have a refresher and things change. And that's why it's done, upon their first renewal.
Okay, and it'll just be that one time upon that renewal, and you're saying that
That's
MedCai
correct.
and the other boards are agreeable to this?
Yes, they are. There's no objection.
Okay, thank you.
My pleasure. Delegate Rosenberg,
My question's been answered. Thank you.
my pleasure. Any other questions?
Yes, I have a question.
Yes, Delegate
Chair.
Ryan.
Thank you. Yeah, I don't see, so I guess the license or and their certificate, is that any cost to that? Or are they paying for it? Or is it just they take the class and they get certified or licensed?
That is, these courses are part of the courses that are offered. Erin, can you read that provision where the courses are offered? 1 second. It's the cultural, there's a language, 1 minute.
So the course is already offered. It's already,
Yeah.
the programs existed.
Courses, there are many courses that are offered.
Okay.
but the bill actually asked the Office of Minority Health and Health Disparities to develop a course.
Right.
Okay,
It's
Right.
a different bill that we're going to talk about.
Okay, go ahead.
It's not in this bill.
Oh,
What you're,
Okay.
Delegate Pena, what you're addressing, there is another bill that is going to
That
have,
addresses that, yeah.
okay.
that
So
who
does this,
develops it. And
okay, so if
Is
that
there
bill
a-
doesn't pass, does it mean this one would be null and void or?
No,
Because
they're-
it talks
they
about
don't,
that program.
they can go together. But I think the idea is, I mean, in this bill, it just lays out that the Cultural and Linguistic Healthcare Professional Competency Program will approve the courses.
Uh-huh.
So there's many out there that are low cost, free.
And some are free.
Okay, so these courses, once they get certified or licensed, okay, so in this bill, there's no fee attached to that, correct?
That's correct.
Okay, so once
And
it's,
let me remind everyone, this was worked out with all the boards and MECHI. They're all in approved. They all agreed to it.
right, I know, but I was just kind of missing something when
Yeah,
it didn't see a fee, and I thought, well, maybe that.
there's no fee
Okay, so no fee at all.
in this bill. Yep.
Okay, so we'll address that later, I guess. And then once the course is developed, who's required to take this course? Is it like a business is required that they're
Healthcare professionals.
Any healthcare
all
license.
healthcare professionals?
Yes,
Just
Okay,
the Health
so like,
Occupations Board.
okay, so if there's a doctor's office or what have you, then his staff will have to take this course.
On the renewal of their license, they'll have to attest that they have taken the course one time,
One
on
time,
that one
okay.
renewal.
Thank you.
Can I
for
ask-
that clarity.
Can I ask you a
Thanks.
question?
absolutely.
So right now, like I know, for instance, Prince George's County does in their school system, they do some of this implicit training. Will they then work with, meaning like, I know they work with their occupational therapists or speech therapists and their PTs. Will they then work in coordination with that, or will this just be an additional training? Or will they try to coordinate some of this so that we're not doing the same training over and over again?
Upon renewal of their license, they have to attest that they have taken a course.
A course, okay, so,
Bias training course.
okay, so,
Approved by the minority, right, health disparities.
Approved by the Office of Minority Health and Health Disparities.
And it's not a burdensome thing. You're not talking about like weeks of courses. You're talking about a 1 hour, 90-minute online course.
That is correct, and most of the time they're free.
right, I just want to make sure that we're not
No, they
wasting time
didn't.
and having
No.
them take the same course over and over again when they've already taken.
No. And you
Okay.
know what, Delegate, when that came up, people said, maybe I took it 5 years ago. It wouldn't hurt to take it again. Like everybody was really on board with it.
Well, that's kind of my
Made it
point, that
very-
I know
yeah.
that PG County School Systems does it every year, because
Yeah,
I know
Yeah.
somebody very close to me that takes it. So I just,
Yeah.
okay. All right, I
Thank
just
you.
This
want
is
to make
one
sure.
time, correct? This is one time, correct, Madam Chair?
One time on renewal.
one time only upon renewal. Yes.
Okay,
Thank you. Any other
thank you.
questions or concerns? No, I appreciate your questions. Thank you. They're really good. Any other questions or concerns? Seeing none. Delegate Riley, you have a question?
Yes, sorry.
It's okay. No need to say sorry. That's why we're here.
So the other bill that we're going to look at, does that actually explain what this program really is asking these people for? Or are we going to have a copy of this program? Do we know what it says or does? I mean,
The other bill will get into the definition and all.
okay,
Yes.
great. Thank you.
My pleasure, Delegate. Any other questions from anyone? All right, seeing none on both amendments that were just moved. May I have a motion on the bill? Oh, no, actually, all those in favor of the amendment say aye.
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 Any opposed? On the bill as amended with both amendments,
Move the bill.
Move
as
the bill.
amended.
Second.
it's been moved and second. Any discussion on the bill as amended? Seeing none. All those in favor say aye.
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 Any opposed? None. Thank you. Good morning, Delegate Johnson. Aaron, the next bill, please.
The next bill is House Bill 78, and this bill establishes the Maryland Commission on Health Equity to employ a health equity framework to provide advice on issues of racial, ethnic, cultural, and socioeconomic health disparities, facilitate coordination of expertise and experience in developing a comprehensive health equity plan addressing the social determinants of health, and set goals for health equity and prepare a plan for the state to achieve health equity in alignment with other statewide planning activities. The commission is required to submit a report by December 1st of each year. And in the 2023 report, they are to include specific findings and recommendations on health effects occurring in the state as a result of specified factors on social determinants of health. And there were amendments that are being proposed by the sponsor of the bill. They were emailed to you as well, and they would add the Maryland Insurance Commissioner to the commission, and also a representative of the Maryland Association of County Health Officers. The amendment also, and so under the bill, the commission's required to study the impact of certain factors on the health of residents of the state, and the amendment would add food insecurity to those factors.
And those bills, the amendment, just for clarification, I was contacted by the Maryland Insurance Administration wanting to be on, and I also was contacted by the health officers wanting to be on. So they want to be on it and they think it's important. Any discussion on this bill? There's only those amendments. Seeing none. On the bill as amended, may I have a motion?
Move the bill.
May I
Second.
have it? It's been moved in second. Any discussion on the bill as amended? Seeing none, all those in favor say aye.
Aye.
Any opposition? None, thank you. The final bill of the day, Erin.
The final bill is House Bill 309, and this bill requires the Director of the Office of Minority Health and Health Disparities to meet with representatives of the Maryland Healthcare Commission and the Department of Health at least annually to examine the collection of health data that includes race and ethnicity information in the state, and to identify any changes for improving the data that is accessible by the office. The office is required to respond to requests for health data that includes race and ethnicity information within 30 days after receipt of the request. And by January 1st, 2022, the office is required to submit to the General Assembly and implement a certain data plan. The bill also updates the Healthcare Disparities Policy Report Card that is published by the office, and it requires each health occupations board to include on an application and renewal forms an option for the applicant to provide their race and ethnicity information. And it also encourages the provision of that information.
That's a good idea.
Okay, and the last time,
Sorry.
yeah, the last time the health report card was done was in 2010. So are there any discussions on this bill? Seeing none, may I have a motion on the bill? Oh, Delegate Johnson.
Thank you, Madam Chair. I just wanted to ask a question. There was a question asked before from Sarita Golden from Johns Hopkins about the program that tracked minority employees. Did we get an answer for that?
No. So where are you going with this?
It was a question that was asked during the presentation to ask about the program that tracked minority employees. I wasn't exactly sure about where the question was going or what was meant by the question. I just wanted to make sure I brought that up just to ask you about it.
No, I don't remember it, to be honest.
Okay.
So I apologize, but I don't remember it at all. She was actually, I worked with her on this bill.
Okay.
So I did not see that come up. So I apologize that I don't remember.
That's okay.
I do appreciate you bringing it up though, but I don't recall.
If you get a chance to talk to her, just ask her where she was headed with the question.
Absolutely.
All right, thank you. Thank you,
I
Madam.
thank you for bringing it up.
Madam Chair, can we move the bill out of committee and with understanding that, I mean, out of subcommittee, that when it gets to committee, we'll hopefully have an answer to that question?
Yes. So any other questions or concerns? On the bill, it's been moved in second, right?
Yes.
Thank you. I didn't even remember that. Is there discussion? Any other questions? Seeing none. All those in favor say aye.
Aye.
Aye. Any opposition? Seeing none, the bill passes to the whole committee. Erin, is there any other business that we have today?
Nope, those were the 3 bills.
Okay, so thank you. So for the members, we're going to be meeting. This was our first one, so a little rusty, but I'm so grateful
You did good.
that you hung in there with me and you helped me remember things, and that you talked and discussed and asked questions. I thank you for that. We're going to be meeting on Tuesdays. Erin will send us, like she did, the agenda and the amendments. You get the link from Melissa. Melissa is the one that sends the link for the meeting. My staff that is on this right here, Edith is the one managing, letting people in to the meeting. So for you to know in the future, if there are any advocates that want to be part of the meeting and they want to be heard, they are allowed. But for this one, because we worked them and everyone was on board, they didn't want to come. They were like, no, we already spoke, which was great. So thank you so much for being with us this morning, and we'll see you at 1:30. I hope you have a blessed morning. Thank you so much.
Madam Chair, after we adjourn, I have a question for the group after we adjourn.
We are live.
Right.
So do you want to ask your question?
Well, it's technical.
Okay.
Okay, the question is, when we were in the hearings, I was in the office using the state system and keeping notes there. When I am not in that building, because that's an intranet, I can't see those notes. Does anyone have a way? If you're keeping notes on the floor system, where we can look at the bills and the testimony and all that stuff, other than copying and pasting and creating, duplication in my Word, does anyone have a way of accessing any notes that you may have made on the floor system if you're not in the State House?
I would ask you to call OIS, Delegate Hill, and ask them that technical question.
Mm-hmm.
Okay?
Okay.
Unless anyone here knows. Any of you know? No? Okay.
No, but I agree with Delegate Hill. There's a lot of challenges when you're working remotely from home with the system. But if you can get an answer, Terry, it'd be great if you could share with everybody else, because I'm constantly emailing OIS and trying to get things figured out.
Very good. Thank you.
Thank you for bringing it up. And I really
Why am I
appreciate
not on here? I thought mine was showing the whole time.
Okay. All right. Well, you guys have a beautiful morning. See you in a few. Okay. Thank you so much.
Bye-bye.